Pilates is a great way to stay active and to support your body through the various changes it's going through during pregnancy. There are certain exercises, positions, and movements that are contraindicated depending on what trimester you're in. A lot of it is very personal, so you may find that something that is contraindicated from, say, the second trimester feels uncomfortable to you in the first trimester, and in that case you should definitely avoid it. Similarly, there might be things that are contraindicated from the beginning of the second trimester, which you feel completely fine doing all the way up until labor or the third trimester, and in that case, again, it's completely fine to continue. I would say the number one rule is you definitely need to listen to your body on that particular day. So make sure you're really tuning into how you're feeling and what feels good and what doesn't feel good. You should definitely remember to stay hydrated during the session, so make sure you're drinking plenty of fluids. Make sure you're not overheating or overexerting your body, so you should be able to hold a conversation throughout your session. There aren't any real contraindications for the first trimester, so you can continue doing whatever you were doing pre-pregnancy as long as it still feels comfortable. Starting from the second trimester, you definitely want to avoid forward flexion, so exercises like the chest curl or the single leg stretch or the 100, where you're bringing your chest, your shoulders, and your head forward. Those exercises should be, and that movement should be avoided because it increases the pressure in your abdominal cavity and in your pelvic floor, as well as the fact that it works on strengthening your rectus abdominis, which is the superficial muscle down the front of your belly, and overstrengthening this muscle in pregnancy can actually lead to a diastasis, so a separation of the abdominal muscles due to the growing baby and the growth of your belly. So definitely avoid forward flexion from the second trimester. You should be mindful of how you're feeling lying completely flat on your back starting from the second trimester. So the reason for this is we have quite a big blood vessel in our backs that can become compressed due to the growing weight of your bump and your baby, which would suppress blood flow and oxygen to you and your baby. So if you're feeling faint or dizzy or uncomfortable lying on your back, then definitely don't do it. This is quite an individual one, so some women feel completely fine on their backs well into the end of the second trimester, and others don't feel comfortable, right from the very beginning. So do what feels comfortable for you. You want to be mindful of your range of motion and avoid overstretching. So your body is releasing a hormone called relaxin that is there to prepare you for birth and releasing the baby. This may mean that you feel more flexible during pregnancy than you did pre-pregnancy. So you need to be mindful of not overstretching, not working to the end range of motion, because this could potentially cause an injury. You obviously, once you start showing, you're not going to want to lie on your belly, so you want to avoid any prone positions. You also want to be careful with any positions where there's a risk of you falling or falling on your belly, so things like planks. Again, this is quite individual. If you don't feel comfortable, you don't feel like you can support your body weight, in the first or second trimester while in that position, then obviously don't do it, but you may feel completely fine doing planks all the way, until labor. And of course, if you do, then that's completely fine. With planks, you also want to be mindful once your belly gets bigger. If you feel any kind of pulling or stretching on your abdominals in that position, that can also potentially lead to a diastasis or make it worse. So you want to then obviously modify or avoid that position completely. If you're doing any work on the equipment like the Cadillac, the Reformer, or the Wanda chair, you want to use the springs for assistance rather than to create additional resistance. You don't need to worry about working in a neutral pelvis. So during pregnancy, your pelvis will shift to a more anterior tilt, so you'll have a bigger curve in your lumbar spine. This is also happening in order to prepare you for birth and the release of your baby. So don't worry about working in a neutral pelvis. You don't need to worry about, keeping standing hip width distance apart or working hip width distance apart or in parallel. You should find a position that accommodates your growing bump. Starting from the end of the second trimester, you want to be really mindful of any kind of inner thigh work. So if you feel any discomfort in your pelvis, you should definitely avoid anything where you're moving your legs away from each other or working against resistance, like squeezing a magic circle. That could potentially lead to a separation of your pubic bone. So you want to avoid anything that could further destabilize the pelvis. I think those are pretty much the main contraindications. Next time we'll talk a little bit more and we'll do some exercises that are great to support your body through pregnancy, prepare you for labor, and then also help you through postpartum.